debate, the member from London West.
Thank you very much, Speaker. I rise today to share the story of London West constituent Kathy Mello. Kathy has been waiting since 2019 for a knee replacement. She lives with a tremendous amount of pain. She can hardly walk. She's unable to work. She contacted my office and told me that she's been put on strong painkillers, but she feels very uncomfortable taking opioids for the long-term basis. She's seriously considering asking for assisted suicide if she doesn't soon get relief from pain. She asked me about accessing knee surgery at the Nazem Kadri Centre for Ambulatory Care, which is operated by London Health Sciences Centre. Speaker, this is a model that solves the crisis that we are finding here in this province, with people like Kathy who are unable to get access to the surgeries they need. The Nazem Kadri Centre is a publicly delivered facility that operates under the auspices of the hospital. It has all the hospital safeguards and oversight in place. It opened in early 2020. It has performed 4,000 procedures, first of its kind in Ontario. It currently has 2 operating rooms, is in negotiations with the province to expand to 6 operating rooms so that they can do more of these procedures and they can expand from very low complex minor procedures for foot and ankle into those hip and knee replacements that are so terribly backlogged in Ontario. Instead of approving the funding for the Nazem Kadri Centre to expand their ORs, this government is instead looking to shift public dollars to private investor-owned corporations where shareholders will make the profit and patients won't get the pain or the relief that they need. Speaker, the investments in facilities like Nazem Kadri Centre actually save public dollars. There has been an evaluation done that says that costs of traditional operating rooms are about $469 per patient. In an ambulatory care centre like Nazem Kadri under London Health Sciences Centre, the costs are $172 per patient. So the province could invest in ambulatory care centres like Nazem Kadri at hospitals across the province. They would save dollars on operating costs, and they would improve patient care. The other findings that have come out of Nazem Kadri Centre is that patients spend less time in post-op surgery or post-op recovery. There is better planning in those operating rooms because they know the time that each procedure is going to require, and so they are able to go through 10 to 15 procedures, methodically each day in each of the 2 ORs. That is the kind of solution that would really make a difference for people in this province, like Kathy, who are struggling with the terrible pain of hip and knee replacements and are unable to get access to the surgeries they need. That is the investment that this province should be looking at. That is why they should be supporting our motion today that calls on the government to fund and fully utilize public operating rooms instead of moving to further privatize hospital operating room services. Thank you, Speaker.